She was only a teenager when the pain began, pain so deep it tore her body apart. For years, she lived as a medical experiment, cut open again and again, without anesthesia. Her body carried the scars of relentless pain and relentless injustice. Her name was Anarcha. She was enslaved. She could not say no. Yet her suffering changed the history of medicine, while the world forgot her face, her voice, and even her grave, until now. Anarcha Westcott was born between 1824 and 1828. She was born into slavery in the United States, in Alabama. Her birth was not recorded with joy or celebration, because enslaved children were considered property, not people. Her life was controlled from the start. Where she lived, what she ate, where she worked, and even her own body, all belonged to someone else. Slavery in the United States was brutal, especially for women. Enslaved women worked in the fields, carried heavy loads, cooked, cleaned, and raised children. But unlike enslaved men, women also faced the risk of sexual exploitation and were often forced to have children to increase the slave owner's wealth. These children could be sold at any time, tearing families apart. From the day she was born, Anarcha lived under the constant shadow of violence, hunger, and forced labor. Yet she survived. Like many enslaved girls, she probably began working in her early childhood, caring for younger children, fetching water, and helping with cooking. As she grew older, she would have been given harder tasks, possibly in the fields. By her mid-teens, Anarcha was entering womanhood. Enslaved girls often became mothers very young, either through forced marriages arranged by their owners or, tragically, through abuse. Around the age of 17, Anarcha became pregnant. Pregnancy for enslaved women was extremely dangerous. They had no access to proper medical care, and their work often continued until the day they gave birth. Anarcha's labor was long and difficult. Historical accounts suggest she suffered for days. Without skilled assistance or proper medical tools, her delivery caused devastating injuries. She developed vesicovaginal fistula, an opening between the bladder and vagina, and rectovaginal fistula, an opening between the rectum and vagina. These injuries meant she could no longer control her urine or feces. The smell, the constant wetness, and the infections brought unbearable shame and isolation. For a free woman, this would have been devastating. For an enslaved woman, it was even worse. She could not rest to recover. She could not refuse work. She could not seek proper treatment on her own. She became a target of humiliation from both other enslaved people and her owners, who saw her as less useful. In the 1840s, a young doctor named J. Marion Sims was working in Montgomery, Alabama. He would later be called the father of modern gynecology, but his path to fame was built on a foundation of pain carried by women like Anarcha. Sims had no known interest in treating women's diseases at first. But when he encountered Anarcha's condition, he saw both a challenge and an opportunity. Vesicovaginal fistula was a common problem after childbirth at the time, especially in women who had long labors. There was no reliable cure, and women with the condition were often shunned. Sims decided to try to find a surgical solution. But instead of practicing on willing patients with anesthesia, he turned to enslaved women, whose owners could give consent on their behalf. The women themselves had no choice. Anarcha was brought to Sims along with other enslaved women, including Lucy and Betsy. Historical records suggest there were at least 9 women in total. Sims promised their owners that he would feed and house them and would not let them die. In reality, the women were subjects for repeated, painful surgeries. Between 1845 and 1849, Anarcha underwent around 30 operations. These were not quick or simple procedures. At the time, surgery was extremely dangerous. There were no antibiotics to prevent infection, no sterile gloves or tools, and no anesthesia to block pain. Sims chose not to use ether, even though it was becoming available, because he believed black women did not feel pain the same way white women did, a racist and completely false belief. The surgeries were performed with crude instruments Sims sometimes invented himself. The women were positioned painfully, held down by assistants, while Sims cut and stitched. If the wound did not heal properly, the surgery would be repeated. And repeated. And repeated again. During recovery, Sims gave the women opium, not to spare them pain during surgery, but to make them sleep and reduce their movements afterward. This slowed their bowels, which he believed would help healing. After years of failed attempts, Sims tried a new approach. Instead of silk stitches, which often failed, he used silver wire. This method finally closed Anarcha's fistula successfully in June 1849. She was the first woman in history to be cured using this technique. This was a medical breakthrough. The operation would go on to help countless women around the world. But the price of this discovery was paid entirely by Anarcha and the other enslaved women, who endured unimaginable suffering without choice, without dignity, and without proper care. Anarcha's life after her cure was long hidden from history. What is known is that in December 1856, when she was about 32, she was admitted to the Woman's Hospital in New York, founded by Sims, and discharged the next month, marked as cured once again. It's unclear why she was there. Perhaps she had a recurrence of the injury or another health problem. For over a century, historians knew almost nothing else about her. She was mentioned only in medical journals written by Sims, and always as a patient, not as a human being with her own story. Only in recent years have researchers uncovered more. Anarcha lived after her surgeries. She became a midwife and nurse in her community. She married a man named Lorenzo, and they had children. She was known as a doctor woman, helping other women give birth and caring for the sick. Despite the trauma she endured, she turned her knowledge and strength into service for others. Her grave was eventually discovered in a quiet forest in Virginia. It had no grand monument, only a small marker. Anarcha's life is not only the story of one woman, it is the story of how modern medicine often advanced at the expense of those with the least power. In the 19th century, racism and sexism combined to make black women especially vulnerable. Enslaved women could not refuse medical experiments. They were often used to test new procedures, drugs, or tools before those were given to white patients. While Sims is remembered in many history books for his contribution to gynecology, the names of Anarcha, Lucy, Betsy, and the other women were almost erased. For generations, their suffering was mentioned only as a side note. Today, we know they were not just cases. They were the true pioneers. Without them, the surgical treatment for fistula might have taken many more years to discover. Without their endurance, countless women might have suffered longer. Yet, they received no recognition in their lifetimes. In recent years, there has been a movement to honor these women. Activists and historians have called them the mothers of gynecology. In 2021, a monument was unveiled in Montgomery, Alabama, dedicated to Anarcha, Lucy, and Betsy. Made from discarded metal, it stands as a powerful reminder that these women were treated as disposable, but were, in truth, priceless. The monument's creation was not just about honoring the past. It was also about confronting ongoing inequality in medicine. Even today, black women in the United States face higher risks in childbirth and are often not believed when they report pain. Remembering Anarcha's story forces us to ask hard questions about how those inequalities began and why they persist. Timeline of Anarcha's life. Circa 1824 to 1828, born enslaved in Alabama or Virginia. 1845, around age 17, suffers childbirth injuries causing fistulas. 1845 to 1849, undergoes about 30 surgeries without anesthesia by J. Marion Sims. June 1849, Sims successfully closes her fistula with silver wire sutures. 1856 to 1857, admitted to Woman's Hospital in New York, discharged, cured. Later years, works as a midwife, nurse, and doctor woman. Marries Lorenzo, raises children. Death, buried in Virginia in an unmarked grave. 2021, monument to Anarcha, Lucy, and Betsy unveiled in Montgomery, Alabama. Legacy and reflection. Anarcha's life was marked by both deep suffering and remarkable resilience. She was used without her consent, stripped of her dignity, and made to endure pain that no one should ever face. Yet she lived on, built a life, cared for others, and left behind a story that still has the power to change how we see history. Her name should stand alongside the medical discoveries she made possible. When we speak of breakthroughs, we must also speak of the human cost. When we honor pioneers, we must remember those whose bodies bore the weight of progress. Anarcha was not just a patient. She was a woman. She was a healer. She was a survivor. And she was a pioneer, not by choice, but by endurance. Her story teaches us that true progress in medicine is not just about saving lives, it's about valuing every life equally, listening to every voice, and remembering every sacrifice.